Did you catch the Bobby Kennedy Senate confirmation hearing yesterday? It was actually really disgraceful. And I'm going to tell you why it was disgraceful and why we as a country should be disgusted as to what's going on in Washington. So yesterday, if you didn't catch it, there was a pretty contentious outbreak between Senator Elizabeth Warren from Massachusetts and Bobby Kennedy. Now, you'd have to be living under a rock to know who Bobby Kennedy is, not know who Bobby Kennedy is. And you'd have to be living under a rock to not know who Elizabeth Warren is. Elizabeth Warren is one of the most progressive senators in the United States Senate. And Bobby Kennedy, comes from one of the most progressive families in the history of our United States. I mean, his father was even more progressive and more liberal than his uncle, John F. Kennedy. But what happened and what's happening right now in Washington, D.C., and what's happening with our healthcare in America is absolutely disgusting. The exact same federal bureaucracies or federal oversight committees have become the hand puppets or the sock puppets of the industry that they're supposed to regulate. It's a well-known fact. In fact, there's an old saying of, we know that they're lying to us. They know that we know that they're lying to us. We know that they know that we know that they're lying to us, but yet we still allow the lie to happen. I believe that this is one of the most pivotal times in our country. The facts are abundantly clear what is going on in our country with regards to our health. Hey, I'm Matthew Galogli, and I'm a maverick. Well, what is a maverick? A maverick goes against the grain. We find our own way. And if you're sick and tired of being pushed around by the insurance companies, come join us. We'll show you the way out. And you'll love medicine again. In 1955, less than 1% or 2% of Americans were type 2 diabetic. In fact, type 2 diabetes probably really didn't even exist. Today, over 19% of Americans are diagnosed with type 2 diabetes. There's another 20 to 25% that are borderline or undiagnosed. Compare this to other countries in the United States, other wealthy nations compared to the United States. Compare this to France, Germany, England. Compare this to the European nations. Compare this to Canada. Compare this to Japan. Compare this to China. Compare this to countries all over the world. And America ranks at the top of type 2 diabetes. Why? Very simple. There is a direct correlation between the type of food and addictive food that we eat and the results that we get. Americans are morbidly obese. And it's not like our gene pool all of a sudden changed, because quite frankly, if you look at America, go back and look at pictures of Americans in the 70s and 80s. Compare that to pictures that exist today. And you tell me, how many obese people existed in those photos from the 70s and 80s, and how many exist today? America is at a crossroads. And I'm going to tell you right now, we need somebody like Bobby Kennedy heading up our health and human services and overseeing all of it. There's controversy. People want to focus on his positions with regards to vaccinations, but here's the cold, hard reality. Our healthcare system is bought and paid for by the insurance companies, big pharma, and the food companies. And it has to change, because you as a doctor cannot do your job. And in order for us to really get back to taking care of patients, for you to be able to actually follow your Hippocratic oath of do no harm, okay? What has to happen is there has to be change in Washington. And what you're seeing going on is the people that are the most vocal out about Bobby Kennedy are the ones that take the biggest checks from big pharma, big health insurance, and big food. You can look it up. You can look it up how much money they get contributed to their PACs. It's regular common information. We have a crisis that is going on in our country right now. We have a crisis of health. We have a crisis of the fact that they are keeping you so busy that you cannot work with the patient. They're telling you that nutrition doesn't matter. Here, just give them this pill. There is a massive crisis. And I believe that the people who are going to fix healthcare in America are going to be the doctors that opt out of this system, the doctors that move to cash. You are the ones that are going to be able to save healthcare in America, because you're going to say, enough, I'm burnt out. I'm not going to be party to this system anymore. I am not going to willfully go on and continue to do harm to the American public by not being able to spend time with them. And I'm going to get out. I'm going to get out of insurance-based care, and I'm going to treat patients again. Now, if you think that your patients don't want this, I'm going to challenge your belief on that, because they do. People want to be healthy. People don't want to be fat. People don't want to have type 2 diabetes. They don't want to have neuropathy. They don't want to lose their feet. They don't want to have kidney failure. They don't want to have heart attacks. They don't want their They don't want their loved ones dying early. They want to be around. They want to be healthy. And they're pawns. And so if you want to change this system, if you're sick and tired of seeing what goes on in America, and you're tired of seeing fat people walk around all the time and type 2 diabetes and people that are morbidly obese, and all you have in your toolbox is a prescription pad to put them on a statin or give them some kind of diabetes medication, you want something different, then come join our revolution. Join the revolution of being a Mavericks. Come let us show you how you can grow and start a cash practice. We have clients that have 80%, 90% of Medicare and Medicaid patients, and those patients are gladly, happily paying cash because they're sick and tired. Don't buy the belief of what people tell you that people won't pay cash. Don't buy the belief of what is told you in medical school that you shouldn't discuss money with the patient. If there's anybody that should discuss money with the patient, if there's anyone that should be discussing care and the cost and investment of that care, it's the doctor with the patient, and that's it. You've been told a lie. And I want to help you break through that lie. Our team is passionate. We want to empower 100,000 of you worldwide to personal freedom and financial independence. So I encourage you, I beg of you, take a look at what's going on in Washington. Look at how bad they are fighting to be able to keep the old system in place. There's a lot of questions that you need to ask. Why would there be a preemptive pardon against people like Dr. Fauci? Why is it that all these people are putting such a massive amount against talking about a man who wants to make America healthy again? Because the data is clear. What has happened in America since the 80s, since the mid-1980s, and you look at how much fatter people have gotten, and you look at the fact that our health span in the United States has dropped. We're the only developed wealthy nation where our life expectancy is declining. And we're supposed to be the greatest country on the face of the earth. Make America healthy again. I normally don't get political. I'm trying not to, but I'm going to tell you right now, I don't think we're going to get a shot to fix this again. This is our one chance. And look, some people are going to have issues with Bobby. That's fine. But if you look at his track record, the man cleaned up our country. He's one of the first environmental lawyers. Look at his track record of what he's been able to do. If there's anyone that can take on this fight, it's him. I want to see our country be able to have people who are healthy again. I want to see people that can serve our country in the military, but we have, the 77% of people that apply to be a part of the military can't get in because they can't pass the health test. They can't pass the physical test. Think about that. That's never happened before in the country, in the history of this country. So be a part of the solution. You want to find a way to do it? Get our free book, The Anatomy of a Seven-Figure Medical Practice. Listen to our podcast. Join one of our webinars. Talk to one of our doctors. Reach out and say hello to us at one of the events. Because there's a revolution underway in America. And it's one where people are sick and tired of being sick and tired. I'm Matthew Galogli. I'm otherwise known as the Chief Maverick here at Mavericks Profit System. And we want to help you get free. Check us out. Have a great day.